Hi everyone, Dr. Chiam here from Ensoul Medical. So in the earlier series of videos for facial rejuvenation, we talked about pigmentation as part of the overall facial rejuvenation process. And we focused on a variety of different pigmentary disorders that we see in the clinic. Right now, I'd like to zoom into one particular condition, pigmentary condition that we see in the clinic, and I would say this is probably the single commonest condition we see in the clinic, and that is melasma. So melasma is a multifactorial skin disease. It is complex, and that is why when we approach melasma, it is often important that we have a good strategy to tackle melasma. So what are the causes of melasma? The single most important cause of melasma is genetics. So everybody who has melasma has probably got it imprinted in their genetics to have melasma. So patients who have melasma tend to find that it runs in the family. Their siblings or their parents may have varying degrees of melasma. But there are some factors that would make melasma worse than it is. And these factors include sun exposure and sun damage to the skin. Hormones. Typically in ladies, it will be because of pregnancy or the pill, which is oral contraceptive pills. Melasma is very often known as the mask of pregnancy, and very often we find that ladies after pregnancy and childbirth start to manifest the first signs of melasma. The last factor that can worsen melasma are actually treatments. So this is what we call iatrogenic melasma, which is brought on by certain treatments such as chemical peels, for example, very strong peels, or even treatments such as microneedling. So these are some factors that could make somebody who is genetically programmed to have melasma manifest the melasma earlier or manifest it in a worse fashion. So as we mentioned, melasma cannot really be cured, that we don't have a known cure for it. It can only be controlled, and very often, even after we lighten the melasma, it tends to come back. And how fast or how bad it comes back very often depends on your genetic predisposition, as well as the factors I mentioned earlier. So my strategy for treating and controlling melasma involves a four-pronged approach. So the four steps include reduction of production of pigmentation by pigment cells. Second step involves reduction of transfer of pigment from the pigment cells to the skin cells. Okay. The third important step is control of hypervascularity or excessive blood vessels underneath the skin. And the last part involves increasing and speeding up the removal of pigments by the skin. So to reduce the production of pigments by the pigment cells, we often use products. In general, we can divide products into two main categories. The first category is over-the-counter products as well as medical-grade products. So over-the-counter products often contain a mixture of different ingredients to help to slow down the production of pigments by our pigment cells. So some of these ingredients include retinol, alpha-arbutin. Some have gentle peels in it to speed up the skin cell turnover, and some other herbal additives such as licorice or witch hazel. These products help to slow down the production of pigmentation, but because it does not speed up the removal of pigments by the skin, it tends to work very, very slowly. We do have medical grade products and creams that we prescribe to patients with melasma. So some of these creams include hydroquinone, and the newer player in the market is this compound called cysteamine. So these have been used by doctors for patients as the first line treatment for melasma. So the second important part of our control of melasma is to stop or reduce the transfer of pigments from our pigment cells to the skin cells. So we do this usually by using laser actually. So the Q-switch laser has been used for a long time to help with control of melasma and reduction of the pigmentation. So how this works basically is that the laser has effects on shortening what we call the dendritic process. So our pigment cells have these dendritic processes, basically like small little octopus arms that transfer pigments to our skin cells. And through the process of laser toning, this is using low dose Q-switch Nd:YAG laser on the skin, the dendritic processes become shorter and they are less able to transfer pigments to the skin cells after a period of treatment. So this only happens at lower doses of laser, which is why we don't usually advocate high doses of laser treatment for patients with melasma, because although the higher doses of lasers are able to shatter the pigments that are present in the skin cells, they also tend to have an effect of stimulating the pigment cells. So in patients with melasma that undergo high doses of laser, they often present with rebound or even darkening of the pigmentation. So the third component of control of melasma involves controlling the hypervascularity of the skin. What hypervascularity means is increased blood vessels underneath the skin. So in patients with a lot of very fine red blood vessels underneath the skin, we find that this stimulates pigment production through growth factors such as VEGF or vascular endothelial growth factor. And how we control the hypervascularity or the excessive blood vessels underneath the skin is by two ways. The first way is using a yellow laser. Basically, the yellow laser helps to close up these superficial blood vessels underneath the skin, and that helps to reduce the stimulation of the pigment cells through the growth factors. The second way that we control the hypervascularity of the skin is through this oral medication called tranexamic acid. Tranexamic acid is actually traditionally used as a medication to promote blood clotting, but we realized that at lower doses, tranexamic acid is effective in patients with stubborn melasma because it helps to reduce melanin production as a result of UV stimulation and sun damage. So the last step is, of course, to increase removal of pigments that have already been produced by the skin. So usually we employ lasers to help us do that, and a variety of lasers such as the Q-switch or the pico lasers can help us remove pigments faster by breaking the pigments into smaller fragments. Once the pigments are in smaller fragments, the body is able to clear it more easily through its normal waste management processes. Other lasers, such as the fractional erbium laser, help us remove pigments faster by increasing the skin cell turnover. So when your skin cells are removed faster, the accompanying pigment that's already been produced inside the skin cells also gets shed away. In some practices, some doctors may choose to use chemical peels such as azelaic acid peels, mandelic acid peels to help to speed up the skin cell turnover in the same way as the fractional erbium laser does. In both fractional lasers as well as peels, the dose and the depth of the peel has to be very, very carefully controlled such that it doesn't cause hyperstimulation of the pigment cells and cause a rebound or darkening of the pigmentation. So because melasma is a multifactorial problem, we often have to juggle all four components of melasma control in order to get a good satisfactory outcome for patients. And every patient is different, so we have to assess the patient's individual skin, lifestyle, as well as risk factors before we can come up with a good plan to tackle the melasma for the patient. So it is important that you consult your doctor before you embark on a treatment to combat melasma. So I hope you found this video useful and informative. Do feel free to give us a call or drop into the clinic for a consult, and we can discuss further on how we can control your melasma.